Hi, guys. So, today I'm going to be telling you about the time that I was misdiagnosed and almost died. So, in order to tell you this story, I have to tell you a little bit of backstory so that you'll kind of understand what went on and why. So, I was 14 at the time. Um, my parents were divorced. So, every summer, my sister and I went to visit my dad. And it was about a 10 to 12 hour drive that we had to take. And the first morning that we woke up at my dad's house, I was really sick. And I mean, I was throwing up. I couldn't hold anything down. My stomach hurt really bad. Like, it was so severe that I thought something was really wrong with me. But, being a kid away from home, just we just figured it was something. I was homesick, but it went on for about a week of me not being able to eat, other than like a few pieces of toast and like drinking some Gatorade, and my stomach hurting so bad. And when I would like look down at my stomach, one side stuck out a little further than the other. And I would tell my dad this, and he was worried about me, but it was one of those things where he just figured, it was just a virus or something. He didn't really think it was anything serious. And so finally, after a week, I just kind of demanded that he take me to a doctor. And he took me to a doctor. It was actually the doctor that I had seen when I was a child, when I lived in the same area. So this doctor had seen me before. They had records on me, knew, that I'd never had any issues like this before. And so the doctor actually had to do a pelvic exam, and being a 14-year-old, I was terrified because I had never had anything like that before. I was a virgin, things like that. It was bizarre to me because I was a good girl and people just didn't touch me like that. And it was kind of scary. And so the doctor, she did the pelvic exam. They ran like labs, they did pregnancy tests, all kinds of stuff. And then the doctor brings my dad into the room and tells him that even though the pregnancy test shows negative, that I must be about 8 months pregnant due to the fact that she can feel what feels like my uterus being very large and what feels like an 8-month pregnant baby in there. And she said that due to the size of my stomach, it looks like I was 8 months pregnant. Well, I was 14. My dad, oh my gosh, I thought he was going to kill that doctor. Eventually, we just left. He paid the bill. I'm surprised he paid the bill because that doctor was crazy. We both knew better. I mean, yes, some teenagers lie to their parents, don't say, that they've been doing things. But, he knew his kid. I knew myself. We knew better. I mean, unless it was an immaculate conception, it was not possible. So, she prescribed me some, like Prilosec or something. She said it was just indigestion because of the pregnancy. So we did take the Prilosec because, we figured I was having really bad stomach pain and it was having, I was having stomach issues. So the Prilosec helped a little bit, but it didn't help that much. And so after another week of being in so much pain and not being able to eat, my dad said, enough is enough. I'm going to take you home to your mom. We're going to see if she can get you into your doctor and see what's really going on with you. So, it's been another week and we go home, my sister and I, we had to cut our vacation at my dad's house short because I was so sick. And we get to my mom's house and she sees what kind of shape I'm in, and she immediately takes me to an emergency room. And the emergency room doctor comes in and looks at me, and he's like, something is really wrong with you because your pregnancy test is showing negative, yet you look pregnant. You've got, small legs, small arms, the body of a small person, but your abdomen is very large. And so they tried to do an ultrasound, but something was blocking everything. They couldn't see anything. So they ended up having to do a CAT scan to see, what was going on inside my abdomen. And what they ended up finding was that I had a very large cyst on my ovary, on my left ovary. And so they said, what had happened is that this cyst looks like it had twisted on itself and it had cut off its life support, so it was slowly dying, and that's what was causing all the pain. It was causing me to be sick, and it was trying to rupture. And if it ruptured, I could die because any kind of fluid or, pus, I know that's gross, but anything that was inside of that could open up and get into my abdominal cavity and cause really bad infection and sepsis, and just, it could kill me. And so they scheduled a surgery for the next day. So they put me in the hospital, and I ended up, again, I couldn't eat anything. They made me take this little bottle of, it was like really salty water. It was some kind of X-Lax or something that made me clear out everything in my system so that when I was in surgery, nothing happened while I was in surgery. I had to get some stents. I think they were maybe urinary stents. And I had to get a catheter. Not fun, especially when you're 14 years old. But, and then I remember, they gave me all kinds of IVs. And the day of the surgery, I will never forget, they had me in pre-op, and they told me that they were going to give me an epidural because they were doing, a major abdominal surgery. And an epidural, I don't know if anyone knows this, but it's what they give to pregnant women when they're having their baby to stop the pain. They put a needle in your back, and it blocks pain receptors from mid-back all the way down. And so they were putting a needle in my back for pain management. And my dad was sitting there watching, and I could see him crying, but trying not to show me that he was crying. And they told me to count. And I think I passed out because I didn't have any kind of pain medicine in me yet. And I passed out before I was able to count down while they were putting that needle in me. And I think it was just a mixture of fear and anxiety. But then the next thing I know, I wake up and I'm in my room after the surgery and in a lot of pain. But that's when they told me that I had a morphine pump, and all I had to do was press a button that was in my hand, and I could press that every 10 minutes. And boy, let me tell you, I had to use that pump because it hurt so bad. They cut me from about 4 inches above my belly button to about 4 inches below my belly button. So my stomach was essentially cut completely open and just laid out. And what they found was a very large cyst. They called it a dermoid cyst. It was benign, by the way, non-cancerous. But they said that it was about 12 and a half pounds, and the size of a basketball. I mean, can you imagine not knowing that that's inside your body? They said it had started growing about the time that I started my menstrual cycle. So I started my menstrual cycle when I was 10 years old. So that was in there growing for 4 years. But just imagine what would have happened if it didn't twist on itself. It could have just kept growing and I wouldn't have known about it. I mean, it's kind of, I'm glad that it happened, even though it caused all of the pain, but it's kind of scary to think about things like that that can happen. And I know some of you will probably Google dermoid cyst. This one was completely clean looking. It wasn't like the hairy ones with the teeth in it or anything. It was just like, I don't know, it just had like veins and blood and stuff running through it. It wasn't gross looking. I had a picture of it, but I cannot find it anywhere. I have torn my house apart trying to find the picture just for this video, but I can't find it anywhere. If I find it, I might post a link to it or something, but I can't find it anywhere. But anyways, I was in the hospital for a week with this whole ordeal. And then afterwards, I had a drain tube, which it's connected at the bottom of your incision, and it has like the excess blood from inside coming out of it, and you have to like clean that out. And that's pretty gross. There's like 2 feet of tubing stuck inside of you. And I had to change bandages for like 2 weeks. Couldn't take a shower because they're afraid that you'll get stuff inside of your wounds. Probably the worst thing I've ever gone through. And even to this day, because they cut through muscle and nerves and stuff, I cannot, like, my stomach in those areas is numb if you try to, like, if I scratch on it or something. It's just kind of like I can feel it, but I can't feel it, if you know what I'm saying. Like, it's kind of weird. So, they said that if I had waited just another couple days, it probably would have killed me. And so I'm kind of, grateful for those doctors and nurses and everyone else that took care of me there at the hospital. And that's the time the doctor misdiagnosed me. If I could go back, to when I was 14 and tell my dad, hey, that doctor misdiagnosed me and you need to sue her because she's a quack, we would do it in a heartbeat. But, you can't really put a number on your life. I'm alive. I'm okay. But I hope she didn't do this to anyone else, because they may not have lived.